Hi, and thanks for joining us. I just want to let you know we are re-recording a portion of this webinar. We were having trouble with our audio the other day, and so I wanted to make sure you heard everything, our opening remarks, and just had a full chance to hear everything that we shared the other day. So first off, I just want to thank you all for tuning in and listening to this, this panel interview. We are really grateful for your continued support and engagement with the Community Foundation. I want to start by acknowledging that 2020 has really been quite a year for all of us. Personally, as a community and as a country, it has really been quite extraordinary what we have seen. And in addition to sort of the experiences that have been quite extraordinary, the other thing that I have been really amazed by is how philanthropy has responded in this time of crisis. We have just been overwhelmed with the generosity that our community has shown especially since March, and I'm just really pleased and honored to bear witness to such generosity in our community. I had a conversation recently with a couple of fund holders that really inspired this program, and I realized as I was sharing with them so much of the information and knowledge that I've gained from our programs team. And in particular, it was knowledge and sort of philosophy around philanthropy and grant making. And so I have asked our programs team to join us today. And so the three panelists that you'll hear from they make up our programs team and are responsible for our discretionary grant programs here at the Community Foundation. They are all incredibly knowledgeable and thoughtful program managers, and I'm just really excited for them to share their experiences and knowledge and perspective on our community and philanthropy. They've really helped shape where we are going as a community foundation. Before we continue, I want to make sure I introduce all the folks that you will hear from today. So Eboni Bugg is our Director of Programs. Eboni oversees all of our Community Foundation discretionary grant making programs. Aiyana Marcus is a Program Manager. Aiyana oversees our large grant programs, and specifically those include our Strengthening Systems and our Shaping Future grant programs. Diamond Walton is also another program manager. She oversees our small grant programs, which means enriching communities, and she's also responsible for some of our special grant programs, including the HEAL Fund and the Community Recovery and Catalyst grants, which we'll talk about today. And then there's me. I am the Director of Advancement, Katie Kling, and I am responsible for oversight of our donor-advised funds and also work to advance the mission of the foundation through resource development efforts. I also want to take a minute to acknowledge one of our colleagues who is not with us today, Ethan Tate. Ethan Tate joined the Community Foundation team in April and is the Donor Relations Manager for Grants and Scholarships. Ethan oversees some of our donor-advised grant-making programs, including BAMA Works, the UVA Health Systems Grant Program, Prana, and Twice as Nice in particular. There are others as well. And then he oversees all of our scholarship programs. And Ethan has been incredibly, worked really closely with our programs team this spring and is actually co-managing the Community Recovery and Catalyst Grant Program with Diamond. So although Ethan's not with us, he has been just incredibly instrumental in really very intentionally bridging the kind of work between the donor relations side of the house and our programs team. So I hope this graphic is familiar to you. We shared this with you all at the end of last month, and it's really speaks to the impact of your contribution and your generosity to our Community Emergency Response Fund. On the left, you'll see the first graphic really speaks to our Community Resource Helpline, which was our program that provided direct financial support to households. There's some key information about that in terms of we dispersed about $4.5 million we estimate about 5,000 households, which equaled about 18,000 people. So 18,000 community members that were positively impacted by this program. I also want to take a moment to acknowledge that this program was really made possible because of our partnerships with United Way and Congregate Seaville. And both of these organizations were instrumental in helping us provide that direct service to households. That's not something that community foundations have historically done or been able to do. And really the partnership is what made that happen. And so we're incredibly grateful for both of those organizations for really coming and joining us in ensuring that our community members were cared for during this time. The graphic on the right illustrates our impact in our nonprofit support. So it was our rapid response grants that went to the nonprofits in our community. Most of the distribution went to support folks who were supporting individuals to ensure housing and then food stability. Eboni will talk a little bit more about some of the other grants that were made there, but again, all of this should be familiar to you. I hope it is. The other thing I just want to make sure that is really clear is that the impact that we had, while extraordinary, it was only possible because of your generosity and your support. During this time, we raised over $5 million from 850 unique contributors. The average gift size was under $500. And I really feel like that just speaks to this idea that we were really a community of neighbors helping neighbors. And Brennan Gould, our president and CEO, frequently speaks about our interconnectedness as people living within this region. And I just think this is such a beautiful example, again, of people really reaching out and helping one another during really an extraordinary time. So as I mentioned, the Community Emergency Response Fund is the sort of the funding mechanism of this. And that funding mechanism has the two programs that that came from that funding were the Community Resource Helpline and the Rapid Response Grants, which we just talked about. The third program that we launched just earlier this month is the Community Recovery and Catalyst Grants. And these three programs together are really what illustrate our approach to philanthropy, our current thinking about grant making. And so during our program today, we'll have our programs team, we'll talk about each of these programs and what we learned and how that helped really shape our work and our support for our nonprofit community going forward. So I'm going to turn it now. We're going to start with Aiyana Marcus. And Aiyana, I mentioned that direct support to households was a new endeavor for the Community Foundation. Can you talk about what was most important to the team when you all were designing that particular program?
Thank you, Katie, for that introduction, and good afternoon to everyone. I am really excited to be here and sharing with you today. So to answer your question, Katie, what we found was most important in our design of the helpline was centering the voices of those most impacted by the issue. So considering how the experience would be for them every step of the way. So first, we made the application available in multiple languages and provided a specific phone line with interpreters to assist our neighbors whose first language is not English. For example, we provided targeted outreach in order to ensure that we had equitable distribution of resources. So we targeted rural areas and communities who may not have ready access to other resources, and those who we understood would be disproportionately impacted by COVID. So older adults, people of color, those who are immigrants, people who work in the gig economy, and those that represent households with lower incomes. And we made the application process fairly simple, so not too many questions or specifics about their situation were required, as well as we did not require any documentation to prove, that they were affected. And we found that people often did offer additional information just to have someone they can talk to, and they simply asked for what they needed, nothing more. And they extended their appreciation of this community effort. So as much as we offered something to them, they offered something to us as well. And we learned from their perspective and their stories. So throughout the process, we continued to err on the side of generosity in how we process the funding requests, and believing people and believing that they genuinely have a need. And we like to call that trust-based funding. And so we ensured that there were low barriers along the way for people to receive their funds. We provided everything from checks and direct deposits to Venmo and even cash delivery payments. So each step of the process, we centered their experience and how we made decisions and carried out our programming.
Thank you so much, Aiyana. So in addition to the support for households, we also had a rapid response grant program. And that particular grant program, as I said, primarily provided support to nonprofit organizations who are providing essential services, food, shelter, medical care. And while many of these organizations were folks that just needed support to increase their capacity to execute on the same work, we also saw some really amazingly creative and innovative solutions come out of these grant proposals. So Eboni, can you talk a little bit about some of those innovative proposals that we saw?
Thanks, Katie. Just to make sure everyone has the context for where we are right now. As Katie mentioned, we had the household program and also these rapid response grants from the Community Emergency and Response Fund. And so I'm going to share about 3 projects that were funded in that endeavor and why we think these are really important projects to learn about and some of the things that we took away from it. The first project was a grant to the National Coalition of Black Women here in Charlottesville, who initiated the Mask Up project and distributed over, I think at this point, 3,200 masks to Black residents throughout our entire region, including every rural area in our service profile. One of the things that we find interesting about this grant is that it was initiated by a concerned citizen who did not necessarily have the resources to both raise funds and to have the volunteer capacity to distribute the masks. And so we appreciate this project for an established nonprofit being able to leverage their resources in order to bring about and bring to fruition the idea of a community member based on current data that we were seeing related to disproportional impact of COVID-19 on individuals in Black communities. The other thing that we want to note and what we were excited about in terms of this grant is that although we know that race is the single largest determinant of health and well-being, educational achievement, and income across the lifespan, very few of our local programs are targeted specifically based on those demographics. We often will use geography or income as a proxy for that information, and yet this group was naming very clearly that based on the data from the Centers for Disease Control and other organizations that Black people were disproportionately impacted and chose to respond to that in particular. The next project I'll tell you about is from Brave Souls on Fire, and they provided mental health support, personal protective equipment, and educational resources related to mental health, again, to Black residents. They also used partnerships with various nonprofit organizations and community-based groups to distribute what they called bags of hope to people who were isolated during the height of the pandemic. This is another example, and you'll hear some of these words throughout our talk today, but also as we evolve and talk more and share more about our grant making and programs that we support. And here, this is a really prime example of leading and following the lead of those who are most proximate to an issue to determine how best to solve a problem. In this case, the leader of this organization is a well-known consumer of mental health services in the community, as well as an advocate. And their funding from the foundation not only supports these bags of hope, but it also indicates that the foundation recognizes that it's not only our large or established nonprofit organizations that are doing good work in the community. And the last project that I want to share with you from the Rapid Response Grants program is initiated by the Bridge Ministry. The Bridge Ministry has been providing substance abuse services in a residential setting for many years in the community as in a well-established nonprofit organization. And they wrote a grant and received funding to provide housing and treatment and education support to individuals from the Albemarle County Regional Jail, which allowed the census to lower in the wake of COVID-19. At that point in time, several prominent officials and corrections officers had contracted COVID-19, and there were significant efforts in the community to de-densify the population in the jail. One effort was to send folks home using electronic monitoring, but what they found was that the lack of supportive services, particularly in-person services during COVID-19, was really insufficient, and they experienced significant recidivism. However, those who were able to relocate to the Bridge Ministry have been doing extraordinarily well, and they're poised to take others. In addition to creating a scenario to protect health of the inmates as well as public health and safety, this project represents some of the ways that we can learn about systemic gaps and opportunities to make systemic change in the wake of an emergency. And so at this point, the Bridge may be poised, and other programs like it, to be an alternative to incarceration rather than something that happens upon release. And so we're excited about the prospect of individuals receiving the care that they need, as we recognize the correlation between our jail census and mental health issues is significant. Thank you. So as you can see, we were quite busy with the Community Emergency Response Fund and those two programs, and we really learned a lot about our community, where people are struggling, where true gaps exist. But most importantly, we really recognize the importance of a social safety net and the role that philanthropy can play in strengthening that safety net. As Katie mentioned, our community came through to support one another in the form of funding the Community Emergency Response Fund, as well as in the formation of networks for mutual aid and community care. And so we saw a huge outpouring of support where neighbors were helping neighbors manage through the crisis, from anywhere from financial assistance, housing stability, food support, as well as picking up things and making deliveries and ensuring folks could be safe in their homes. one of the things that that's come out of this for the foundation that I'm sure you'll continue to hear from us on is this notion of moving in the direction of solidarity from our charitable endeavors. And this place of solidarity really reflects some of the things that you've already heard, such as those who are most proximate have the most information about their experiences, as well as creative solutions to solve them, and we should trust them to solve them. And it means leveraging our resources to bring forth and bring to fruition ideas that are generated by individuals in the community. And that is a do with rather than a do for attitude that we're taking. Again, this solidarity stance recognizes that we are all givers and receivers in the system, and that the perception of power that is held by those who have funding versus those who do not is something that we see as a false construct, and recognizing that we're all participating in the system, that every person in our community has something unique to contribute, and the sharing or leveraging of resources is just another way for us to leverage the potential and capacity of all of us. In addition to mutual aid and community care and notions of solidarity, we recognize truly the importance of data systems, as well as ethics regarding the use of that data. A significant portion of our time during this program was spent on maintaining the confidentiality of applicants, and also while at the same time trying to create a picture of what our community was dealing with during that period of time. And so we're constantly trying to battle those things, and we're also recognizing the need for sophisticated systems and ethical decision-making with regards to handling data. And finally, I hope that you could see from the slide before that, the Community Emergency Response Fund provided grants for a wide variety of organizations. And we recognize that that's a necessary thing to ensure a full response to the needs that are being faced, that the community are facing. And so, we funded grassroots organizations, we funded newly formed coalitions that were fiscally sponsored. We funded some of our large institutional partners that have been grantees for some time, as well as some new organizations that in the wake of COVID, and because they were new or smaller, could be a little bit more flexible or nimble in their response and adapting to the situation. And so it really does take all kinds, and for us to be able to have our ears to the ground and the trust of the community for them to reach out to us, and then we can support these brilliant ideas.
Thank you, Ebony. I hope my video or my audio is a little better than it was. Made a little shift here, and so hopefully y'all can hear me better. I apologize that you couldn't hear me earlier. So I so appreciate Ebony and Aiyana sharing sort of where we were and what we learned. And so now I'm going to ask Diamond Walton to speak a little bit about our new grant program, which is our Community Recovery and Catalyst grants. And so Diamond, if you could share a little bit about the program, and especially think about how some of these learnings really fit and shaped our work going forward, that would be great.
Absolutely. Thank you for your question, Katie. So as we were wrapping up the Community Resource Helpline and Rapid Response grants in late spring, we began to turn our attention to the fall grant round. And at the same time, we're hearing from our community partners that their nonprofit organizations were still in need of significant financial support due to canceled fundraising events and having to significantly cut back on income generating activities. And in the broader community, the pandemic had not eased up, and we had the compounded impact of a resurgence of civil unrest due to police violence against Black people. So we quickly realized that the fall grant round needed to be different if we were truly going to address community needs. So the foundation launched a coordinated effort to consolidate the fall grant funds to sign a new grant program and communicate these changes to key stakeholders. As a result, the foundation established the Community Recovery and Catalyst Grants Program with the generous support from the Bama Works Fund of the Dave Matthews Band, Dorothy Batten, UVA Community Health, and the Twice as Nice Fund to help nonprofits recover, sustain, and build. This special grant round also offers important non-monetary support for capacity building, which Eboni will discuss in more detail later. Our goal throughout this grant program is to support community organizations in response to COVID-19, especially as they support vulnerable communities and communities who have been in the pandemic, as well as organizations who are working to address systemic racism in our region. Next slide, please. So the Recovery and Catalyst grants will be one-time unrestricted awards of up to $50,000 to be used over a period of 1 year. The grant applications will fall into one of three categories depending on an organization's needs. The first category is Recover, and these are funding requests to recover an organization's capacity to meet its mission and return to how the organization was functioning prior to COVID-19. The second is Sustain, and these are funding requests to sustain an organization's capacity to meet its mission and continue its current level of operations and programming. And the third is Build, and these are funding requests to build on an organization's capacity to meet its mission and start something new in response to the disproportionate impact of COVID-19 pandemic and the ongoing systemic racism. So applicants will be able to have an opportunity to sustain under. They'll only select which one category. And the applications will be reviewed by the Community Recovery and Catalyst Grants Review Committee, and they will send recommendations to the Foundation's board for final approval. Now I will pass it on to Eboni to talk about the capacity building piece of the Community Recovery and Catalyst Grants program.
Thanks, Diamond. I'm really excited to share with you all some good news about how we'll be supporting our nonprofit and community-based partners beyond our grant dollars. In addition to the work that our staff does to support in program design and evaluation, we recognize that many organizations need other kinds of professional services in order to fully leverage the funding from the foundation that they receive from our grants. So we are partnering with an organization called Catch a Fire. Catch a Fire is a national organization that offers a web-based platform for nonprofit organizations to access community capacity building resources that would most likely be beyond their capacity in terms of finances. When we conducted our Heal Fund program, as well as feedback from our enriching communities and other grant partners, they all indicated that some kind of capacity building was needed in order to meet their goals. We would often receive requests from grantees for referrals for accountant services or marketing or branding. Many of our small, rural, and new organizations don't have the capacity to take on additional staff, and much of their grant dollars could be used on these professional services. And so we wanted to create a situation where they would be able to access these things without financial repercussions. And so we're partnering with Catch a Fire on a pilot this year to be able to offer over 150 subscriptions to this platform that they will be able to access at no cost to them. They will have access to extraordinary professionals who are agreeing to give their services on a pro bono basis on a project base. This not only allows the organizations to access resources to build capacity, it is also a professional development tool, as many of the organizations are learning alongside their volunteers as they're completing their projects. So we'll move on to the next slide, and I'll share a little bit about the kinds of things that Catch a Fire is able to do. Anything from providing data support to human resources, some technology management like Google ad campaign support, that also includes marketing and branding work. Anything that you can imagine that might support an organization can be accessed through the portal. There are over 160 ready project modules, and then some can be customized for the organization. One of the things that we're excited about with this platform is that it has the capacity to save organizations anywhere from $5,000 to $500,000. They have an unlimited access to projects, and Catch a Fire has an over 95% completion rate in doing so. And so the foundation was able to provide funding for the subscription from our fund, so it would not impact our capacity to fully grant to organizations, and again, at no cost to them. We will be targeting certain organizations for participation in the pilot, though it is open to all of our applicants, and for the Community Recovery and Catalyst grants. We will be targeting rural organizations, as well as organizations that have budgets under $250,000 or less than 6 employees, as well as those that are led by people of color. So I'm going to pause here, and we'll move forward to talking a little bit more about how the programs team plans to support nonprofits through this process.
Thank you, Eboni. I do want to just pause for a minute and say a couple things. First off, I hope you have heard from all 3 of our panelists so far, just really reflected in their responses, a deep commitment to hearing the community, really listening to what folks need, being responsive to our current context, and really being thoughtful about the additional burdens that are being placed on community members, on our nonprofit community, our nonprofit organizations, in light of COVID-19 and in light of all of the civil unrest that has come out of the murder of Black folks across our country, the structural racism that has really been spotlighted in a way that, a light has really been shown on some really deep and important issues. And I just always appreciate our programs team for really being mindful of and responsive to what our community needs. I also want to say that I oftentimes have a chance to meet with our nonprofit partners, and one of the most consistent things I hear from nonprofit partners is that they appreciate the partnership that they receive from our programs team. So from design meetings to feedback after a grant round, it's a very consistent and committed effort that our programs team makes in order to support our nonprofit partners. So I'm always in awe of their work, and so I just want to take a minute to appreciate them, as I do all the time. A couple of other things I just want to mention is, please make sure you use the Q&A box. So if there are things that are coming up for you, please indicate that what you'd like us to talk more about. And so I want to just mention that. So in that sort of theme of partnership and the partnership that the programs team engages with our nonprofit partners in, Aiyana, I'm wondering if you can talk a little bit more about partnership. This is one of the questions that came to us from the registration. And the question was, can you share more about the partnerships that you engaged in during this effort? And really, how does your philosophy behind those partnerships, how does that show up in our work?
Absolutely, Katie. So for the Community Emergency Response Fund, the foundation partnered with United Way, Seaville Community Cares, the County of Albemarle, and the City of Charlottesville to provide distributions to individual households. And it made sense to have a variety of organizations to ensure a full response versus each organization embarking upon their own individual effort. And so our philosophy around partnership echoes what Eboni mentioned earlier regarding mutual aid and community care as a center point, embracing solidarity over charity and centering the voices of those most impacted or proximate to the issue. So while each of the partner organizations were very different, we all brought our individual expertise to the conversation as we were building out the program. It wasn't a matter of whoever had the most money or the widest reputation who took the lead in every area. It was truly who had the most on the ground knowledge of those who were most impacted by the pandemic. And so, for example, Seaville Community Cares had already begun giving distributions to households and thus had a lot of great knowledge around what practices work best. And even though they weren't technically the largest organization at the table, they were able to lend direct insight. So for example, I shared that a lot of folks didn't have access to a bank account, and even to get to the grocery store or another check cashing place to cash a money order can be a barrier. So including cash deliveries became part of the plan, even though oftentimes as institutions, we rarely consider that as an option that's doable. And so sometimes failure of our own imaginations can be an enemy of progress. However, we embraced their knowledge and expertise, and it worked. And no one took advantage of that system. Everyone was safe and socially distanced, and many people received help that they never would have or maybe would have struggled to receive because of that. And so we opted to embrace trust-based funding, trust of our partner organizations who had already started the work, and trust of our community members that we are called to mutually support. So in this example, Seaville Cares was a critical partner in helping training with the phone operators on how to best engage with individuals and what questions needed to be included in the application, what information should be disseminated and what information should not. And while a lot of operators received demographic data so that we could have a general overall understanding of the population we were supporting, we did not include that information when sending out the payment request because it wasn't necessary for that part of the process. So we took care of everyone's personal information. We only used it for the purposes that we said we would, and everyone agreed with that and understood that each partner's role, including who would have access to what information, who would do which part, it was all built upon the principle of what is best for those who are most impacted or most proximate, trust. And we carried that into our CERF grants as well to nonprofits. The process was not cumbersome or heavy paperwork for them to request funding. We had a lean committee who reviewed applications on a rolling basis, and week by week we made funding decisions, funding distributions to those on the ground, providing safety net services to individuals. So from our co-funders to our nonprofit grant partners, we valued and enacted trust-based relationships throughout that entire continuum.
Great, thank you, Aiyana. A couple more that we're going to go through that we received prior to the program, and then we do have some questions coming in that we want to make sure we get to. One of the questions was about rural outreach, and that's been a priority for the Community Foundation for some time. Eboni, can you talk a little bit about our efforts for outreach in our rural communities? Sorry.
Absolutely, thanks, Katie. You know, as many folks have been hearing from the foundation over the past few years, that we are really invested in ensuring that we create a thriving and vibrant region that works for everyone. And that means our entire region, not just the Charlottesville and Albemarle area, but the rural communities that surround us. And so to that end, I think we have been and will continue to embark on various activities to ensure that we understand what those needs are and can respond appropriately and in a targeted fashion. Some of the things that have been some of the things that we've done so far is first, we have conducted twice now Center for Effective Philanthropy surveys to get feedback from organizations. And this time around ensured that the feedback could be segmented based on locality. That way we have some information directly from our rural partners that we can respond to. We also conducted a series of focus groups early in the spring, late winter, and including a whole focus group that was comprised of individual grantee applicants from our rural communities. We recognize that resource distribution is lopsided in that area, and so we again have targeted rural communities as participants in the pilot for our Catch a Fire subscriptions. And we are continuing to work with our rural organizations in the form of site visits so that we can learn a lot about what's happening. We conducted a number of site visits also before the pandemic that gave us some really unique insight into what's happening in our rural communities. We have made it, a goal of ours to ensure that we know who the leaders are in that community and where the hubs are for information. And during the height of the household program with the Helpline, we ensured that we conducted some targeted outreach. So even after the program ended publicly, we coordinated with many of the small and local rural food distribution and aid organizations to ensure that people who hadn't heard about the program or weren't able to access it or didn't have adequate internet were able to do so. So it's definitely a priority for the organization. And this year, in addition to this program, we are drafting and doing research to create a long-term community outreach plan to ensure that those voices are available to us and that we're listening to them all year long.
That's great. Thank you, Eboni. I'm actually going to, Eboni, have you answer this next question. We had a question come in from one of our attendees, and she was curious about, from your experience and expertise, what sort of gaps do we anticipate in the next 6 months or so? So we see sort of simultaneously government aid is pulling back, and we see cases of COVID-19 surging. And so as you sort of as we think about those two things happening simultaneously, do we anticipate another phase of rapid response is needed, or how might we sort of see our way through this sort of next 6 months or so?
That's a fantastic question. I think that we can anticipate, ongoing financial need. We learned a lot about this distribution program, and I think that should, that become a need, we have some insight now in how we might conduct such a program or support such a program in a much more efficient way. We also, I think some issues that have come to the fore that we can see growing over the next 6 months would be issues related to rural broadband internet access, also childcare might be an issue, as well as, everything to do with our education system. And so there's that piece. Also, the need for housing folks individually, we suspect may increase. So some of these things are longstanding issues in the community, but they have risen to the level of emergent with regards to public health. And so some creative solutions to ensure public health and safety, as well as individual support, are going to be necessary. But I think that there are also some larger systemic things like the internet, our school system, and systems of childcare will be huge in the next 6 months.
Great, thank you. I don't know, panelists, if you want to talk a little bit more about the data that we've collected and how we, Ebony, you talked about, or Aiyana, I believe you talked about sort of for being mindful of that data. And I'd love for you to talk a little bit about how we anticipate, I'm not sure using the data is the right word, but how do we consider the data that we've collected so far about our community?
This is Ebony. I'll jump in there, and it sounds like Aiyana has some thoughts on this as well. You know, I think it is important to note that this is information that we've been entrusted with, but we do hope that it informs. And so really right now we're still in the stages of analyzing that data, and that will definitely help us determine how we'll use it. I will say that in many instances, the quantitative data is truly unsurprising in terms of who's been impacted the most and where those individuals live and so on. But there is some new information about sort of what is the next rung of vulnerability in our community that we have taken for granted as being stable. And then I think where some of the gems in terms of this data is going to lie really is in a qualitative analysis and how people are sharing their stories and the things that they're experiencing and how multiple systems are interacting and where the gaps lie. So I'll pause there and hand it over to Aiyana.
Absolutely. Thank you, Ebony. Yes, I guess one thing I will add is Katie mentioned I also manage our large multi-year grants, including our strengthening systems and shaping futures. And so we are certainly looking at this as we are embarking upon a journey to better structure those grants to be even more impactful. And so we are planning to launch a community engagement effort. And so, as Ebony said, we're still in the process of analyzing it, and some things are surprising. So we're definitely finding ways to how can we be responsive based upon what we already know, and then looking at what we've learned from this data, how can that inform the new structure of our grants and how we're looking to engage with the community. And of course, keeping that, the integrity of that along the way.
That's great. Thank you, Aiyana. We also had a question come in about sort of how does the broader community really think about supporting one another? And there's always the answer of financial support, but I think that we'd really like to think about sort of beyond that. What do you all see as ways that our community as a whole can really wrap its arms around those that are most vulnerable, whether it's in rural communities or communities of color? I'd be really curious to hear how you all think about what's the best way for us to be good neighbors during this time. And I will let anyone answer that one, and you probably will all have something to say about that one.
This is Ebony. That's a big, long kind of question with an even bigger answer. Some of the things that come to mind are actually really, I'll just share the first thing that came to mind when you said that, Katie, and that is, to believe people when they're telling you about their experiences. I think that in the process of, I think someone else asked about kind of, the working poor versus those who are extraordinarily indigent, middle class folks. I think the democratizing kind of nature of this virus has brought people into awareness of the suffering that other people engage in and have maybe shifted their thinking towards recognizing the systemic causes of those issues versus individual personal responsibility or choices. And so I think that to remain curious about why something has happened, as opposed to, just simply that it's happened or who it's happened to, can be really critical as our community is, sort of gauging and assessing how can they lend their support. The other thing that I would say that is there's so many things beyond dollars, even though those are quite needed as well. And I think one of the things that we'll be endeavoring to do is thinking about you know, non-monetary support and bank, you know, sort of pooling that information. We saw some extraordinary work in online forums for mutual aid that brought lots of skills and expertise to the table for people who were struggling during the pandemic. A good example of that was someone's legal expertise and human resources expertise provided pro bono through a mutual aid website information on how to navigate the unemployment documentation process. And that was tremendous. And this is, you know, someone who, you know, might not otherwise consider themselves to be a philanthropist, and yet that's precisely, you know, what that is. And so I think if we can extend our definition of philanthropy, then I think we can recognize all of the small and large ways that we can support each other. So I'll pass it along.
I can quickly say that from my experience working with some of our partners in our surrounding counties and our rural partners in particular, I've definitely learned that just in terms of how they manage relationships and the types of trust and the pace at which they communicate with each other and the tone and the type of presence they have with each other it was really helpful for me to understand the care and the humor and just the types of relationship building that's already there, and we're just able to support. And so, and also with communities, non-English speaking communities, just the different ways that we get information to them, and the format and the tone and approach is also so important. And so I think I have definitely learned that in partnering with folks who are part of these communities, who are excited to be partnering with CACF, just the most appropriate ways to partner with them has been a great experience.
Yes, and I'll just briefly add that echoing even what was said earlier about the data, there really is a trend here as far as how we're telling stories, how we're sharing folks' narratives, and it's very important. And one of the ways that we can support people is, as much as possible, letting them tell their own narratives, because if we have certain information without the proper context, without understanding these underlying root, you know, issues and things within our system, then there can be a narrative or story out there that's actually very harmful to communities without that full understanding and without their voices directly. And so definitely throughout all of this and in our role at the foundation, sharing that even more so with the wider community, again, from their standpoint.
Thanks, Aiyana. If I can just add a little bit to that, I also think that it may be helpful, even, you know, if people are investing their time or, you know, financial resources in philanthropy right now, to also be patient. You know, I think that there are some organizations that are poised to make, you know, a significant impact in the community, and they have the structure and the resources to do so, but may not have the context. And I think that it'll be helpful for people to start to think about outcomes along multiple levels. And so sometimes, you know, it's not how many people were served or what have you, but maybe the degree to which the community had a hand in crafting a project, and being on the lookout for those types of things to ensure that their voices are heard. What we have been learning really and truly over the past few years in analyzing the results and the experience of folks who are working with our grant partners is the stronger their relationship is with the communities that they're serving. And as much as they are able to participate in the decision-making process about how those dollars are spent and how programs are structured, infinitely the more successful they have been in achieving their goals, not necessarily, you know, what we say they should do, but what they are saying they really want to do out in the community. And so that does take time. You know, I think when we think about structuring grants and structuring, you know, charitable contributions, there's this expectation that something is going to turn around quite quickly. And I think that we're all learning that these issues are deep and systemic and require a lot of help. And so I think a part of it is also keeping the stance of, you know, we'd like to see what happens and how you're planning this, as opposed to coming with fully formed ideas. But how much time are you spending trying to figure out if this is the right intervention at all, or what might be? And so giving, I think, our partners space to do that and making sure that our community partners know that they have the space to do that, I think will invite innovation as well as achieve the level of impact that we're hoping to.
That's great. Thank all of you so much. I knew you would have really, although I put you on the spot and asked you a really big question, I knew that you would have really amazing insights. And what I heard in all three of you is really this it's about being curious and really coming to and listening to folks who are most proximate and really understanding the community in a really deep way. So we are getting very close to the end of our time. There was one more question that we received, and I want to make sure that this is sort of my job to be really clear about. So I have gotten this several times in the last few months as programs have wound down and our work has shifted. And the question is, are you still accepting donations? And yes, we are. You know, you've just heard from our programs team and our three panelists today about all of the amazing work they're doing. And it is so important that our nonprofit community stays vital and viable and growing and have the ability and time and space to innovate. And we know that we can't rely solely on the social safety net. We know the importance and of taking care of one another, and really this is our time. And we started this sort of last effort, and Diamond mentioned we have some incredibly generous partners in that. The Bama Works Fund, Dorothy Batten, UVA Health Systems, and Twice as Nice really came together and helped seed a lot of the fund that we have, or kind of reseed the fund so that we were able to launch this new grant round. And our goal was always to leverage those into an even greater pool. And I also recognize that we are all in this pandemic. You know, I think we all had a mindset, oh, we just need to get through a few months, and it's becoming more and more clear that we're in this for the long haul. And so I just wanted to make sure that you knew that yes, we are still actively hoping to raise funds and really be able to support our community, in particular our nonprofit community, so that they remain viable and innovative and supportive to all of our community members. So I want to thank all of you so much for coming today. I hope you stay in contact with us. There is on our website, there's an opportunity to sign up for a newsletter. So please feel free to sign up under that email updates. If you have any questions, please reach out to any of our panelists, to me. As I mentioned, this will be on the website in the next day or so. And we really so appreciate your time today, and look forward to partnering with all of you now and in the future. So thank you all so much.